ahead, Dr. McGeehee.
Welcome, everyone. We're sorry for the delay. For the next hour, we're going to talk about the DOT market and how to get started providing these services in your own practice. So the National Registry of Certified Medical Examiners is a program of the Federal Motor Carrier Safety Administration. It began being effective May 21st of 2012. And that means that the training is available and you're able to go and take the certification test. But the more important part here is the compliance date. So by May 21st of 2014, if you want to be able to provide the commercial motor vehicle medical examiners, medical exam for commercial drivers, then you have to be certified in the National Registry. If you want to be able to provide the commercial motor vehicle medical examiners, medical exam for commercial drivers, then you have to be certified in the National Registry. In 2005, when I started working with FMCSA on this program, we estimated that 40,000 medical examiners were going to be needed to be able to provide the exams. And that number was based on what we thought were the number of commercial drivers in the United States. We thought that there were about 4 million. That the ratio of drivers to the number of certified medical examiners is based upon the Aviation Medical Examiner Program. They have 400,000 pilots and 4,000 medical examiners, aviation medical examiners, and that has been sufficient. So we just applied that same ratio and came up with 40,000. So in regard to the medical exam, drivers can be certified for up to 2 years. However, at this time, 42% of drivers only get a 1-year certificate because of some medical condition that they have. So how many actual commercial drivers are there? There was a study done last year. There's actually 7 million active commercial driver's license holders. Therefore, 58% get an exam every 2 years, so that would be 2 million exams. 42% have to have it every year. That's another 3. So we know that there's about somewhere, or at least we're thinking that there's about 5 million exams a year, which is more than what we had initially considered. However, what we really didn't know about is that there were 7 million inactive commercial driver's license, and we expect that that same ratio appears. So that's another 5 million exams a year. Now, these drivers have not been getting a current medical certificate because they haven't been driving. Even though by regulation they're actually supposed to, they haven't been doing it because they would never get caught without it. And you may have already, if you're doing these physicals already, you may already be seeing people that are coming in and they're getting a medical certificate and they're not currently driving. But most drivers, what they do is they use this as job insurance. So they always know that if they lose the current job they have, well, I can always go back to driving. And so we expect that many or most of these drivers will begin getting a medical certificate. So no one really knows how many medical exams are performed yearly. But if you start adding up the numbers, it comes up to quite a bit more than what we had initially thought. And that doesn't include school bus drivers. And there are some drivers who do not have a commercial driver's license, but they are still required to have this medical certificate. And then most of the time when drivers go to work for a different company, then that company requires that they have a fresh current medical certificate. And the reason for that is that they want to make sure that they are certified and medically capable of driving on the day that they hire them. So we still don't really know exactly how many medical exams are performed, but since you'll be reporting the ones that you complete starting in May, then after a year or two we'll have a good idea. So one of the examples of a non-CDL driver who actually has to have the medical exam is the picture of the pickup pulling a trailer. Anytime there's a boat manufacturer or a trailer manufacturer that needs to have their boat or trailer delivered to a dealer, then many times they'll use non-CDL drivers with pickups to deliver them. So anytime that vehicle, if it weighs 10,001 pounds or more, the entire vehicle, truck and trailer, then they have to have a medical certificate. So in the way of providers that are needed, As of August 12, 2013, there was a meeting held in Washington, D.C., and so FMCSA now estimates that there's 20,000 certified medical examiners that are needed. Now, I know that that's less than the 40,000, but the particulars to the commercial driving program is a little different than aviation. If you take out that we think that there might be 10 million exams, I think that probably 20,000 is more than enough, and will give us the geographic distribution that is needed. Now, the interesting news is that if we're trying to get 20,000 certified medical examiners by May 21st, where are we right now? So as of August 12th, there were only 1,041 certified medical examiners in the National Registry in the entire United States. There have been 11,000 providers that have registered on the website, but only 1,041 have actually become certified. My understanding, however, is that that is growing by about 300 a week, or at least it was during the month of August. Some of the other things that you need to be aware of is that these drivers, or most of them, are also required to be in an alcohol and drug testing program. So this is another service that your staff usually performs in your office. It represents an additional revenue source, and the urine test is used for drug testing, and typically either a saliva or a breath test is used for the alcohol testing. But generally speaking, when you tell your staff that you're going to start doing urine drug testing, this is what they kind of think about that. They kind of think that, oh, golly, I've just gone to hell. But what should you be thinking? You should be thinking liquid gold, because that's really what alcohol and drug testing is. Your staff does all of the work, and it can be a very good payer and a very good source. Part of the reason that it can be is that drug testing crosses both the interstate and intrastate drivers. So if their vehicle is over 26,000 pounds, or if they carry any hazardous waste, or they transport 16 or more people, they have to be in an alcohol and drug testing program. So we know that there are 7 million active truck drivers who are required to be in a federal program already, and the drug testing requirements are that 50% of drivers have to be tested randomly for a drug test, and 10% have to be annually checked for alcohol. And there are a number of different types of testing that are required. Anytime a company hires a new employee, there's usually a drug test that's taken. And then if there's other drug tests, for instance, if they had a violation of drug testing policy, they might have to have return to duty testing. And if they're in a treatment program, they can be tested up to 5 years to make sure that they're staying drug-free. There's also not only the federal motor carrier people or commercial drivers, there's also taxi drivers, railroad, pilots, school bus, and pipeline. All of those entities have drug testing programs. And so it's once you become accredited to be able to do the DOT drug and alcohol testing, then you can provide that for all of the different DOT administrations that have drug testing programs. And it's the same kind of thing as with the physical exams. We don't really know how many drug tests for the Department of Transportation are done, but it's probably more than what we think. And the reason is that drivers have a tendency, if they're owner-operators, they have a tendency to work for more than one company during a year. They have a tendency to look like the grass is greener on the other side of the fence, and they jump companies. So there are times, or some drivers, that may get 2, 3, or 4 or more physical exams and drug tests every year. We just haven't been able to track them. And once you become accredited to do the DOT, alcohol and drug testing, then you are also able to do all of the non-DOT drug testing, because the DOT protocol is considered the gold standard of drug testing. Now, the non-DOT drug testing market is, we think, is 7 to 10 times larger than actually the DOT market. And generally, it just includes pre-employment testing, reasonable suspicion testing. Some companies do have randomized testing. It's just up to the company what they want to do. And then also there is a certain amount of testing that's done in the court or legal area. I generally don't advise that doctors do this kind of testing because you may be called into court to testify. But I did run into a doctor in California that this is all that he does. And he charges $4,000 for his expert testimony, and he does quite well. So there are a certain number of niches that you can select to be in should you decide to. Okay, so not only are there the physical exams for the truck drivers, which is listed third here under the National Registry, there's also school bus driver exams. Usually this is promulgated by the Department of Education in your state, and sometimes they use a different form. Sometimes they have a slightly different medical standard. But generally speaking, in all but 3 or 4 states, those can be performed. If you're a chiropractor, there's 3 or 4 states that you cannot at this time be able to do the school bus physical. If you're a medical provider, of course you can be an aviation medical examiner and do the pilot's exams if you're an MD or a DO. And also if you're a MD or a DO or a nurse practitioner or a physician assistant, you can do the U.S. Coast Guard Merchant Mariner exam, and that is under review right now for allowing chiropractors to do that. If you have a taxi company that is in your city, they are actually part of the FTA. Also busing usually is under FTA. If that entity is taking federal funds, then they may also have to have physical exams, and you would be able to perform those physicals as well. So there's more physicals than just the ones just for commercial drivers. Pipeline and Hazardous Materials has a drug testing program. The Federal Railroad Administration has a very, very short medical exam and also does drug testing. The Homeland Security, the Immigration and Naturalization Services, they have a program called the Civil Surgeon, and this is for those that are going to apply for citizenship in the United States. They have a physical exam. Crane operators have a physical exam, and then even auto racing have physical exams. And for the most part, MDs, DOs, DCs, nurse practitioners, you can all participate in those, except for a civil surgeon. Civil surgeon, I don't think that at this time chiropractors are in that program. Okay, so if we kind of start putting everything together here, if you put the non-DOT market and as far as drug tests and the physical exams for commercial drivers together, I estimate that there's about $1 billion that is spent annually, and it has to be spent annually because it's required by law. So as a result, it is more recession resistant than some of the other healthcare services because there isn't a choice. If you want to work, then you have to do it. So if you do not have an occupational health practice, this just adds revenue to your current profit stream. And for the most part, the staff does most of the work. In the case of the alcohol and drug testing, they do 99% of it. You really don't ever see it unless there's a problem. In the case of the physical exam, they're probably going to do about 2/3 of the work for you. One of the nice things is that if you leave your office, for most of us, you don't get paid. But if your staff is now a revenue producer, and if you have clients for DOT drug testing and alcohol testing and also all the other employers that are doing that, you can actually have an income and have a revenue source while you're out on vacation, which is nice. If you're getting ready to retire, then you have clients, company clients, that add value to your practice if you're going to be selling it. We already talked a little bit about being a certified medical examiner. You will be the expert on this, and you'll know more than anyone else. The actual physical exam requires very little physical effort. and there is no diagnosis that's required in performing that physical exam. Depending on what your state regulations are, it may not constitute a doctor-patient relationship because it is considered to be a fitness for duty exam. You would have to check your state laws in regard to that. But in regard to getting paid, it's usually hard cash. It doesn't involve insurance billing because it is occupation related, not health related, and so there isn't any managed care. If it's a driver, they usually pay at the time of service, either in cash or by a credit card. And if it's one of your companies and your client, then at the end of the month, you send them a bill and get paid in full. One of the interesting things is that this is about the only type of program where you get paid to have potential patients come to your office. And so if you treat them well during their drug tests or during their physical exam, they're very likely to seek you out if they need to have any kind of health care. So how are you going to get started? If you aren't doing this yet, what do you need to do? Well, first of all, you need to consider what services you're going to offer. Everyone wants to do the CDL physicals, and that's the first thing that you should do. It's the what you need to do is go ahead and take the training and pass that test so that you can get started. I don't suggest that you try to get accredited to do the alcohol and the drug testing until after you have completed getting certified. It's just because there's a lot to learn when you go to that accredited training program, and so and if you had to also learn how to do the alcohol drug testing at the same time, you're just putting a big load on yourself. So it's important for you to know that even if you're not going to be doing the alcohol and drug testing yourself, your staff is going to do it, you need to take the training to do it. And the reason is that they're going to be coming to you. Okay, so hang on a second. Sorry about this. I don't know what happened here. So anyway, they're going to be coming to you. Your staff's going to be coming to you whenever there's a problem. So you need to know how to help them. But also it helps you be able to talk the talk and walk the walk. Trucking companies can tell if you know what you're doing by how you refer to things and whether or not you know about all the different aspects that they're involved in. So you're also going to want to identify your clients. Who are they? They're going to be motor carriers, they're going to be independent owner-operators, they're going to be school bus districts and drivers, even government highway workers. And one thing for you to remember is that in the case of the medical exam, those drivers that don't have CDL license, all they have to do is be driving a vehicle that weighs or is rated to carry over 10,000 pounds. So you need to know who your clients are. So in the case of motor carriers are generally, they do want to get good pricing, but it may be even more important that you're close to them and nearby, that you can perform all of the services that they need. And if you are able to get in same-day appointments, then that is an advantage that your office can offer. And the reason is that a lot of drivers let their certificate expire. Motor carriers do have a need for after-hour accident testing, and they do want low seat time. And low seat time means that a driver doesn't come to your office and sit in the waiting room for 3 hours. They have to pay the drivers for that amount of time, and the amount of time that he's off the road costs them money. Last thing is that they want someone that knows what they're doing. They want to make sure that you're qualified. And of course, they won't have a choice after May 21st. Everyone will be certified, but the federal regulation states that motor carriers are responsible for their drivers to be medically certified to drive. And that means that if you make a mistake, then they are actually liable for it. Now, what do the drivers want? Driver wants that, they want that same day appointment because they let their certificate expire and they're losing money until they can get back on the road. They are probably a little bit more susceptible to lower pricing unless they've expired and they can't find a place to get in. Then the first place that can get them in is the place they're going to go. They don't want to sit in your waiting room because the time that they're out of their truck costs them more money, or rather keeps them from making money. Usually they like to have it easy if possible, but the thing that they really want is they really want to pass that exam, and we'll talk a little bit about that here later. So here's what you need to do for your preparation. You need to go ahead and get certified, and then target the small clients first, because they are much more susceptible to changing or making changes. Get your credentials for alcohol and drug testing. Check to find out what your pricing. It varies by area, but there is a way for you to find out what your area, what the average cost is in your area, and that is quite simply to call around to some of the other providers that are within 10 to 15 minutes of you and just ask what they're charging. You need to be able to identify all the clients in your area, and you can do that with a motor carrier search. And you may also want to identify who your competition is, how close they are to you, whether or not they offer all of the services, whether or not they offer same-day appointments or even walk-ins. And then lastly, you need to identify your strengths. Can you do those things? Will you take walk-in appointments? All of those things can be real important in helping drivers use your office. Some of the things that you might consider is an online scheduling, if you have a way for drivers to find that. But if you do have online scheduling, you can give them to your clients that manage a large number of drivers, and they can actually make an appointment from their office rather than having to call you. They can look and see what's available, and they can look and see when a driver is going to be in and match that up. Phone book advertising has really kind of gone, is really decreased lately. I'm not sure that you certainly want to be there. I'm not sure that having the big ads is as important everything, but if you do have the phone book advertising, you want to make sure that in your ad that you have in there that you perform the CDL physical exams and that you are a National Registry Certified Medical Examiner. Regardless of where you are at, you have advantages. For instance, if you are in an urban area, then you're going to have more competition, and so your pricing is probably going to be more competitive and maybe a little lower. But the good news is that you have an almost unlimited number of drivers in the area that you can draw from for clients. If you're in a smaller city or a rural area, well, you're probably not going to have nearly as much competition. Your pricing is probably going to be higher, but you don't have the thousands and thousands and thousands of drivers to pick from. So it's real important, though, that you establish your clientele as early as you can. Some of the things that you have to consider is your office underutilized? Can you allow flexible scheduling? And you want to look at what is the relative charge compared to your other local competitors. And what I mean is, in the case for chiropractors, generally speaking, the reimbursement rate for a physical exam is generally more than what they can get for adjusting a patient. Whereas for a medical provider, they may actually be able to make more on just a regular office visit than they could from performing a physical exam. And you might want to consider that when you're considering who your competitors are. You might want to look to see what your overhead is. But if you're going to be involved with competitive pricing, usually 10%, maybe 15% below your competition is enough. That is enough to attract a driver to your office. And then you have to consider if your staff is underutilized. Keep in mind that they're going to do a half to two-thirds of the exam, but they'll do all of the alcohol and drug testing. It may place more burden upon your staff. These aspects are things that what some people call, I call the dark side of doing alcohol and drug testing and physical exams. But I've had other people say, oh no, this is the green side of doing it. Okay, so as far as your location, drive-by traffic is an advantage simply because you can have signage outside. It's very likely when you're first starting this that no one knows that you are doing that or can do it, and you want to make sure that they do. Truck parking, however, is not as important as you might think because it's not that often that they bring a truck to their exam. But there will be a few, so if there's a way for someone to have easy truck parking, that's something for you to consider. But I think it's actually better to have an office that's easy to see and easy to find and easy to access. Keep in mind that for alcohol and drug testing, any bathroom can be made suitable for doing drug testing, even if you are sharing that bathroom with the public. it actually is possible. One of the things you want to do is start finding clients, and you already have clients right in your own practice already that need this exam. They just don't know that you can do it. So it's very important that you have a sign on the inside of your office, possibly in the waiting room, and if you have drive-by traffic, you need to have some kind of sign that traffic can read as they drive by. There is actually a company that does video advertising inside of State Department of Motor Vehicle offices. Here's a phone number that if you're interested in doing that, you could. But remember that you've got patients in your office that already need this, and you have patients who are employers, and therefore they may have a alcohol and drug testing program in their for their company, and you might be able to market those services to them. When you talk about motor carriers or employers or drivers, there's two types. There are the for-hire, which means that they carry anybody's freight, and then there's the private ones that carry their own freight, like Walmart. UPS would be probably more of a for-hire. In regard to marketing, there's lots of different ways for you to market your practice. One of the things that we do is we have an internet map and we have a driver mobile app, but you can do the same kinds of things for yourself. And in actuality, the driver mobile app, you don't have to be a Team CME member to use it. And I think we have a slide in a minute about that. But if you don't have some kind of a system for notifying drivers before their card expires, you need to have a recall file. And make sure that you mail that out at least a month before to let them know that their card is going to expire and invite them back to your office. However, until then, you need to make sure that drivers know that starting May 21st, they have to go to a certified medical examiner in the National Registry, and that works great if you're already certified, or at least tell them that you're in the process of getting certified. There are a motor carrier list. There's a Team CME motor carrier list that you can get for your area. There may be others that can get that for you. And basically what you can do is send letters to contact them. You can go and visit them or do cold calls. Or you can even organize a meeting in your area and invite all the motor carriers and let them know what's coming up for them. Some of the other associations or groups you might want to contact are trucking associations, the laboratories, and other third-party administrators that have companies that they do drug testing for. You won't be able to use your lab account, but at least they will send drivers to you so that you can do a collection and your staff. And usually that's about $25, and your staff does all the work. Team CME does have a number of doctors who are working in truck stops, and they appear to be doing very well. I don't think we have a large enough history to be able to tell you exactly how good of an idea that is, but people are doing it and trying it at this time. This is just a slide of my own sign, and you can see that it says I'm a chiropractor, but you can see that it says DOT Medical Examiner, and that's because since 1992 chiropractors could participate in this program, and that is the federal term at that time. That term has changed. I had DOT Certified Medical Examiner added to my sign, but if you're going to be putting your designation on your sign, you need to check with your board before you do that, your licensing board, and I actually think that probably the best terminology to use would be National Registry Certified Medical Examiner. That's probably the term that drivers and motor carriers are going to be looking for. If you have a DMV, you might want to try to put some advertising near one. And if you look to the right here, that you can see that there's a sign there. That's actually a sign for drivers to come to our office. You can do the same things in your area. And once you get your clients, you want to keep them. And so whenever you have a driver, if you remember, they want to pass that exam. And many of the times, you know, they're pretty nervous when they come in to see you, because they're afraid if they don't pass that exam, they're done driving. So you need to make sure when you have a new driver come in, that you tell them that you are going to do everything legally possible to make sure that they are stayed on the road. You're going to help them continue to drive, and you'll do everything you can to help guide them through whatever the medical guideline is so that they can keep driving. And if you do that, then you have made a friend, and they will come back to you time after time. Now, for drivers that have medical conditions, especially cardiac conditions or pulmonary conditions, there's going to be a real advantage for them to come back to the same medical examiner year after year. And that's because they're going to have to provide a lot of medical records, and if they go to someone else, then they have to start all over again. So that's why part of getting your clientele built now is so important, and building up for those clients, or building up those clients who really, it will be much easier for them to come back to you, and it'll be easier for you too if you already have the records from the last time you did the exam. So your attitude in regard to helping drivers does have an effect upon your clientele and whether or not they'll come back to you. So this is the mobile app that we talked about. You don't have to be a member to use this. What it does is if you help the driver, give the driver the instructions on how to save this, you can actually have them save your clinic information and that you are their medical examiner. And so then when they come up to an expiration date, then they can contact you directly just with a push right at the end of their finger. And the other nice thing is that the driver can save his expiration date. Now, you might not think that that's such an important thing right now because drivers have to carry their medical exam certificate card with them whenever they drive. But starting January 30th, this coming January 30th, they no longer will have to carry their medical exam certificate because it will be electronically into the SIDLIS system. But so they can throw it away if they want to, but they still need to have an idea of when their expiration date is, and this way they carry it with them wherever they go. So if they have a mobile phone, mobile device, then they can have their expiration date right there on their phone. And then they don't have to worry about it wearing out. We also have a paid driver app, and you don't have to be a member for this either. This is just a really great tool for your drivers, and it adds a couple of features, but one of the features that's really great is that they will get an email warning them that their certificate is about to expire 1 month before, 1 week before, and on the day of their medical certificate from your office, showing that you're his medical examiner with your contact information. And another benefit to the paid app is that their motor carrier, their employer, can also get those expiration alerts and be aware that they need to come back and see you. So those are just a couple of things that that you can take advantage of, and you don't have to be a member of Team CME. So one of the things that I frequently get asked is, what's going to happen in the future? What's going to happen with prices? What's going to happen with drivers? How's this all going to work? Well, first of all, the question I hear most often is pricing. What's going to happen with pricing? Well, I think what's going to happen is that, generally speaking, the average cost of the exam, I believe, is going to go up, simply because it costs the doctors their time and money in order to get certified. So the average is going to go up. What's going to happen to the people that are doing it for $45? They're going to recognize that this is an exam that they can no longer do for $45. It takes too much of their time and their expertise to be able to do it. So they're either going to drop out and not get certified, or they're no longer going to charge $45. What's going to happen on the other end? Well, on the other end, the guys that are charging $225 or $200, they probably really don't want to do it anyway. My guess is that their offices are probably already busy, and so the busier that your competitor's office is, the less likely he will become certified. So I think that the people probably at the top are probably going to drop out. But I still think that there's going to be a slight shift to the right, so that the average price, which right now I believe is probably between $75 and $90, I'm thinking that's probably going to push up to about $100. What's going to happen with drivers? Well, drivers, especially those that are driving across country, can have a lot of electronic type of equipment with them, their computers, their phones. I think what's going to happen is that drivers are going to be using their mobile devices or something like that. They're going to use that mobile device to contact you if you've been their medical examiner and they have a problem. They are going to use that mobile device to find an office if they don't have a medical examiner. They're going to look at your schedule online, see if it fits their schedule. They're going to schedule that appointment online, and they're probably going to pay for it online before they get to your office. I don't know how long it'll take for us to get there. My guess is probably within about 10 years. That's what's going to happen. And then I do believe they are going to go back to the same provider, you know, if they can, if they're in that area still. They're going to try to return to that provider that helped them get through all of the medical standards and made sure that he did everything that he could to keep them on the road. So this is just our very last slide, and is actually the end of our presentation. But if you do have any questions, I would be happy to answer any questions you might have. You can contact me here at this office number, or I believe that you can ask questions using the chat area.
Yes, thank you, Dr. McGehee. This has been very informative. Now, for all of you, we will take some questions, and Dr. McGehee will be the person presenting the certification program coming up on November the 16th and 17th in Ontario. So that will be, you can register for that through CCA. Now, if you have a question and you want to talk to Dr. McGehee right now, you can raise your hand and I will take you off of mute and you can talk to him for a few minutes. So I'm looking at all of the attendees, and so if you raise your hand, we can take you off of mute. I'll give you a second. So far there are no questions. Okay, here's one. Dr. DeFries is asking a question, so I'll take him off of mute. Are you there, Dr. DeFries?
Yes, I am. Can you hear me?
Okay, you can talk to him.
Dr. McGehee?
I'm here.
My question, of course, is about how one markets this. It sounds like it's pretty much a given that if you're certified, you're going to start getting business. What would be the most, what's the appropriate way and what's the most effective way that you would find for letting the people in the industry, the commercial driving industry, know that you're available?
Well, there's really two different clients that you're going after. You're going after drivers, and you're going after motor carriers or companies. And so you're going to have a different way to do both of those things. So in the case of motor carriers, the first thing is identifying them. But here's an important thing for you to remember. Generally speaking, the guys that are driving those 18-wheel vehicles, they probably are not going to be the biggest part of your clientele. Your local clientele, even though you don't really realize it, is going to be composed more of the UPS driver, the Coca-Cola driver who takes Coca-Cola to the store, or Frito-Lay's. It's going to be construction guys who are driving a pickup and pulling a trailer behind them. And so you're going to find out that probably big truck drivers are going to be a smaller part of your market than what you might think. But you still need to contact the motor carriers. So it is very helpful for you to have a list of motor carriers. Keep in mind, however, that motor carriers have been having to provide this service either for their drivers or at least have their drivers stay current. And so they probably have one or maybe even a number of medical examiners that they've used in the past. The problem is they don't know if that guy is going to get certified. So you want to make sure that you introduce yourself to them and make sure that they know that, hey, I'm already certified, you don't have to worry about me. Now, the other side of that is how do you contact the drivers? Well, there isn't any list of drivers available, so you have to use the methods that you would use to contact any part of the public. So you're going to use signage inside your office. You're going to use signage outside your office. You could even run radio ads saying that you're already certified, or put ads in the paper saying that you're certified. And there's a second reason for doing that. And that is, and again, this is the dark side of doing these, is that you really want the other providers around you to know that you're already certified and that you're going to do this, because that adds one more deterring factor in their decision-making process of whether they're going to become certified. So you really want to broadcast, generally speaking to the public, that you're certified and that you're there to provide that service. Now, there are also a large number of drivers that look for medical examiners and also companies using the internet. So in the case of Team CME, we spend a tremendous amount of money on internet advertising and search engine optimization in order to capture that. But you can do the same thing. You can have, I would suggest that you have a website and that you have listed on that website that you provide these services to also try to capture that part of the market. And that's part of what we do.
So there's certain keywords you'd use on your website for SEO?
Oh, yes, there is.
Search engine optimization. Okay.
Yeah, and you know, I mean, in some places, drivers call this the CDL physical. There's CDL medical exam. There's DOT medical exam, DOT physical. You know, there's different words, and you know, generally you have to pay a search engine optimization expert to be able to look and see what are the keywords and phrases that you want to use and how much you can put it into your website. It's kind of tricky stuff. We spent tens of thousands of dollars literally on doing just that.
See, that seems a little high price for what you're getting, though. It's not that many keywords, though. You know, I realize there's some other factors involved, but still.
Well, you know, when you're trying to be number one, you know, on Google, it's not just a one-time thing. You have to have them working on it all the time, and so we have 4 people that work all the time on our network.
Wow. Okay. Now, as far as if we were just to want to do the CDLs and not do the drug testing or any of that stuff, is that going to be a deterrent to being able to market ourselves to carriers?
Well, it could be. I mean, most of them do want somebody that can do it all. But you know, there are lots of docs that just do that, and you know, I think they'll do good. I just don't know if you'll get. I don't know if you'll get the company, as many of the companies. The drivers, you may not have too much of a difference with that, but if it's a company where they know they're going to have to do the drug testing and the other things, yeah, I mean, it could make a difference.
Is there some way that you've found that if a doctor does not do the drug testing, they can develop a relationship with a lab so that it's as if they're doing the testing, or if I had a person come in for an exam, I could send them out for the drug test to a facility? Is there anything like that, or is that just too complicated?
Oh yeah, we actually have some of our doctors that have relationships with third-party administrators. They're the ones that do the randomized testing for alcohol and drug testing, but they're not physicians, so they can't do the physical exam. So what they do is they work together. The doctor agrees that he won't do the alcohol and drug testing, and then that he sends the drivers to them, and then they send drivers to him for the physical exam.
That sounds like a really perfect setup for somebody who doesn't want to do the lab work.
Yeah, you have to decide for yourself. I understand there are some reasons why a person wouldn't want to do it, but I will tell you that it does add a significant revenue stream.
Well, that sounds certainly motivator to do.
Yeah, it's a good thing to do. Plus, then you can also do all of the other drug tests that's not drivers. So you know, it adds up. You know, we do a couple of thousand of these a year.
Okay. Thank you.
Thank you.
Okay, someone else has a question. Dr. Doxy, are you there? I'll unmute you now. Okay, Dr. Doxy has a question.
Can you hear me?
I can hear you just barely.
Okay. I was just wondering if you have any classes in Northern California that you're going to be doing.
Well, last weekend we were in Reno. The California Chiropractic Association, I think that we have had some preliminary talks about maybe having something up in Northern California, and so I think they would probably be your best source of information on that. We don't have anything set up. But maybe
Yes,
Linda can comment on that.
I believe that we're working on that. Yes.
Okay. And that would be prior to the date when these certification things need to be done, correct?
Yes.
Perfect. Thank you very much.
Okay. All right. Next person with a question is Dr. Kay Colby. Here you go. Are you there?
Hi, Dr. Mike. Thank you for putting on this webinar. I'm wondering what is involved in the class? What's involved with doing the certification testing? Are there any required textbooks for the class?
There aren't any required textbooks for the class. You'll get class notes, but there are some textbooks that you may consider getting. There is an online medical examiner handbook that's online at the National Registry website. We actually give you directions on how to do all of this as part of the first hour, but you will have to download that, and you'll have to read it and actually mark it up. We help you in identifying exactly what to do with that. But it doesn't cost anything other than your time. It takes, unfortunately, you have to print it one page at a time. You have to download it one page at a time, and it takes about 4 hours. If you're a Team CME member, though, we put it all together, and you can download it as one file. So you'll have your notes. There's 2 other paid-for handbooks that you can purchase that I am aware of. And we give you the information for both of those. One of those textbooks is done by Natalie Hardenbaum. She is a medical doctor. She came out with her 5th edition. Unfortunately, that one is actually already outdated. Some of the standards have changed. And then actually our instructor, who's Dave Thorpe, he's written a book, and it's a living manual, which means that you get updates. And if you do decide to come to the seminar, they're actually available for you to purchase from him at the seminar. Now, in regard to, I know that's only one of your 3 questions. The other question I think you were asking about the testing. The test is a 120-question, multiple-choice, computer-generated test that is given at high-security testing centers, such as those used for other professionals, like nursing tests and those kinds of things. The cost of that test is $79, and you call the nearest site that's offering the test and schedule to take it when you want. There's 260 testing sites across the United States. So generally speaking, you're probably going to be within 1 or 2 hours, certainly, of any of those. And then you have one other, and then what is the testing about? Well, that's a good question, because there's a real misconception about what is the training. I'm sorry, what's the training about? What's going to be included? We expect that you already know how to do a physical exam when you come to this training. But there's not very much about how to actually perform a physical. You've already been taught that and tested on that when you got your licensing. But you don't know what to do with a driver who had CABG or coronary artery bypass surgery 1 month ago. You probably don't know whether he can be certified to drive or not. Or if you have a driver that has hypertension, does he get a 2-year certificate or a 1-year certificate or a 3-month certificate, or do you disqualify him? So we teach you the medical guidelines so that you know how to determine whether a driver is medically qualified to drive. That is all new information for you. And it's 12 hours of training, and let me tell you, it's a jam-packed 12 hours. You're going to learn a lot, but I will tell you this, when you go out of the door, you will be a better doctor than when you came in. And we have had doctors, we have chiropractors, medical doctors, we've had every profession that can be a certified medical examiner come to our training. In fact, usually at every training we have more than just one profession, more than just chiropractors. And we've had doctors that said, I've been doing this for 50 years and I didn't think I was going to learn anything. And we've never had anybody leave and say, wow, I didn't learn something here. And you will too. It's challenging. And I should tell you too, the test is challenging. You will have to study. Everyone has to go home and study for a week or 2 to learn all those medical standards, all those waiting periods, all those certification intervals, all of the testing that has to be required, all the pulmonary function testing, all the echocardiogram information. You have to go home and study it for a little bit, because When you go in to take that test, you can't even wear a hat in or a coat in or take a pencil in. In fact, the way they do it, they video you while you're taking the exam, and you hardly get to wear your clothes in. So it's challenging, but you know, we want it to be that way because, to be honest with you, you'll be a better medical examiner, and to be honest with you, if it's not something we want everybody to do. It's better if everyone doesn't do it if you and I get certified.
Thank you very much.
Thank you.
Okay, the next question is from, let's see here, Dr. Gillis. Dr. Gillis, are you still there? Dr. Gillis? Going once? Going twice? Okay, we'll go on to the next one. Dr. Hilo? Are you still there, Dr. Hilo?
Yes, I'm here. Can you hear me?
Yes.
Hi, Dr. Hilo.
Hi, Dr. McGee. How are you?
I'm good. How are you?
Thank you. I'm fine. Thank you. This is a very beautiful and a great presentation for your webinar. I learned a lot by just listening to you. I have 3 questions, and I think you mostly answered them. The first question is, how long it will take to complete the whole program and be licensed with the alcohol and the drug testing after I take your DOT on November?
Okay, so I would expect the course is 12 hours. I expect that you're going to take 2 weeks to study. You're going to schedule to take the test. So let's say that takes 3 weeks. Once you've become certified and passed the test, now you can turn your attention to doing the alcohol and the drug testing. So we do that over the internet, one-on-one with a staff member. So you call our office. We send you the manual and some test kits and chain of custody forms. You study that for maybe 2 or 3 nights at the most, and then schedule to take your training online. And each training takes about 3.5 to 4 hours. So probably within a month you can have everything accomplished if you target it as for your activities.
Okay, that's good. So within a month, technically, if you take your time, 2 months. Now, if I take your program, the 12 hours, which is I did sign in for the class, you're going to cover most of the materials that will be asked during the test. Is that correct?
Yeah, you're going to have more than enough material, believe me.
Okay, good. I know it would be better doctor doing the physical exam, but all my concern right now is be certified.
Yeah, our training has to have in it what's called a core curriculum, and so we have to maintain that. And then there's other things that we're required also to cover, like we're required to show you how to register on the website, how to download the online medical examiner handbook, how to input your certificate information into your account. Because what happens is that when you register and put in your license number, FMCSA goes and actually contacts the board of your state and verifies that you have licensure in their state. Then they're going to verify that you actually took the training before they'll actually approve you to be able to take the certification test. And then after you take the certification test, it takes 2 or 3 days, sometimes a week, for them to actually certify you.
Good. One last question, Dr. McGee. If you have license for multiple states, once you're licensed with the National Registry, it's going to show us for both multiple states. Is that correct?
The National Registry certification is a national certification. You can only perform the physical exam, however, in the states that you are licensed in. So you would have only one National Registry identification number that would use on all of the exams that you perform, regardless of what state you're practicing in. But keep in mind, you've got to have a medical license or medical license or chiropractic license in the state that you are performing the physical in to be able to do it. Okay.
Thank you very much, Doc.
Yeah, and there's advantage, by the way, of being able to do that, because you could travel all over to do physicals in their facilities. So that's a good thing.
Okay, very good. Thank you so much, Dr. McGeehee, and I hope that you have a good presentation with in November. If any of you have further questions, you can contact Dr. McGehee, or you can contact me if you need the telephone number, or if you need his email address or whatever. We are recording this, so if you want to listen to it again,